I'm going to run through how to shop for an ACA health insurance plan. Other terms for this: Obamacare, an exchange plan, a marketplace plan, healthcare.gov. It all means the same thing. So basically, you're most likely in one of three camps. If you are looking at these plans, you're either self-employed and need to get your own health insurance, you work for a small company that doesn't have a group plan and you got to go get it on your own. And the third group would be like early retirees. You're waiting until 65 when you can get Medicare. You need something before then. So what I'm going to do is run through this as if I'm a consumer, as if I'm shopping for my family for this. I'm going to assume a couple of things just to keep this on target, on topic here. I'm going to assume you understand what a deductible is and just you're familiar with health insurance plans just as a consumer. You don't have to be an expert, but I'm not going to go into like the academic breakdown of everything. Just going to keep it to how can we narrow the field down to like a handful of choices, like 2 to 4 plans to really choose from that I feel good. Like these are the best 2 to 4 for me. And it's just up to me kind of what I want among those. So here's how to enroll, shop, buy these. It's all in one place. You can either go to healthcare.gov, which is the government's site for this, or you can use something called Health Sherpa, SHERPA, and that is what I use as a broker. It helps me do it on behalf of people, and if someone uses it and I can kind of meet them halfway and kind of help them finish it out or see what they're looking at. And it's just a better experience I have found either way for the user. So I recommend you use Health Sherpa. This is my link, so it's got a little bit of my branding on it, but healthsherpa.com is where you go for that. It's got all the same information, all the same plans. It all feeds over to healthcare.gov, so you don't have to do both. You do it all through Health Sherpa. With that said, I'm going to jump into it. So this is where most likely you'll start on a screen that looks like this, and it just wants very basic information. Just pop in your zip code to start if you want. Mine is 30068. That's Marietta, Georgia. In case you're wondering, it's like Metro Atlanta. I'm going to click See Plans and Prices. And then it's going to kind of spoon feed you or help you kind of paint by numbers. So it's not so overwhelming. So I'm just going to follow along with it. First things first, let's just figure out who needs to be covered. So let's say I'm going to do a couple and 2 kids. So let's just say a male and female. And I'm going to click Add My Spouse. Let's say 35, female. And then self-explanatory, if either of you use tobacco or someone uses tobacco, be sure to indicate that because pricing is going to change. And if you lie, they will find out. So click Add a Dependent. Dependent is just a fancy word for a child, if you didn't know. So let's do 2 5-year-olds. Let's just keep it simple. 2 5-year-old males. I think it's kind of funny that it would ask if a 5-year-old's a tobacco user, but anyway. Eligible for coverage through a job, Medicaid, CHIP, or Medicare. You can ignore that for now. Again, that gets to the enrollment portion, which is not the point of what we're doing here. And none of this is permanent. This is just a shopping tool. So I'm going to click Continue. All right, and now this is household income information. And the reason this is being asked is most people get some form of subsidy on these plans based on their household, the size of their household, their age, and how much household income there is. It's a somewhat complicated equation. It's different for everybody. But for an important thing to note, the first question here, how many people are in your tax household? This is different than how many people need to be covered in some cases. So like, let's say you're a household of 4, but only 3 people need coverage because someone, works a job and gets a group plan and they just have it for themselves, and it's cheaper to go this way for the rest of the family than, hopping on the group plan, which is the case a lot of times. In that case, you would only put 3 people on the enrolled portion, which we just went through, but you would still do 4 for your tax household. Just think of when you file taxes, when you answer questions about how many people, that's the number. And then estimated income. key word here is estimated. I know it's you know, if you can get it close to what it'll be, that's ideal, but no one's going to come banging down your door if you're off a little bit. So the way to do this is for some people this is easy, for some people this is complicated. Revenues go up and down if you're self-employed, that kind of thing. What you can do is there's an income calculator here which helps kind of break down, hey, what counts as income, what doesn't, and that will help you get close. You want to get as close as you can without going nuts trying to figure it out. So let's say let's do $100,000 just to keep it simple, nice even number, and then we'll click continue. So based on what I've put in, $938 a month is the kind of initial estimate for the subsidy for this case. Now, this will be finalized when you do the enrollment, but this just gives you a good start, and this is more often than not pretty accurate. So one note on this, and then we'll go to the plans. The subsidy here, the technical term is advanced premium tax credit. So it's a tax credit that you can opt to get the benefit of up front in advance. So, and it comes in the form of a monthly discount on whatever health insurance plan you choose. Now, you don't have to take the discount up front like this. Most people do, but let's say you are someone who has unpredictable income, then you can just bypass it and you're still entitled to it. You pay full retail for whatever health plan throughout the year, assuming you're okay with that. And then at the end of the year, when you go to file taxes, you're going to have that large, 12 months worth of, in this case, $938 a month as a tax credit. All right, so let's click continue. And then as I'm recording this, it's the middle of June. So it's not the open enrollment period, which is in the fall, and that's where anyone can hop in, no questions asked, and select a plan. Plan would start on the 1st of January of the next year. In the middle of the year, you can enroll in a plan mid-year, but you have to have a qualifying life event to do so. The most common ones you can see here: lost or losing health coverage. That means you were laid off or you quit your job, most likely, or you retired. And that job had benefits, had health insurance benefits, and you're losing those. Change in household size. So you had a kid, you got married, you got divorced. Change in primary place of living, you moved. So those are the big ones. Anyway, I won't belabor that too much. You can read into that here. In most cases, lost or losing health coverage is kind of what triggers someone to search for this stuff. So I'm going to click that for this case. And then a note: these qualifying life events, there's a 60-day window on either end of the event itself. So like, I quit my job and sometime in June, and my benefits run out at the end of June. My group health plan ends at the end of June, which is June 30th, right? So that's the date that the event technically happens. I've got 60 days after that to do something, and then my window closes. But if I'm ahead of the game, which I'm sure you are, you've got 60 days before that date of June 30th in this case, if you knew it was coming, to go ahead and do this, get the enrollment done, have it locked and loaded so the coverage can start as early as possible, which is July 1st in this example. And that's what I recommend. So there's no gap in coverage, which is never a good idea. So I'll click continue. And then it wants me to plug in hospitals, doctors, whatever, optional. And I'm going to skip it for now. We'll get back to this. Prescription drugs, I'm going to skip this for now, but you can plug this in, and I'm going to show you why I skipped those. And speaking of skipping, if you don't want to save your progress here, this is just kind of a call to action to get your email address so you can come into this at some other point. I'm going to skip that for now. All right, so now we've got the market. These are all the plans that are available to me in my zip code, 30068. Your zip code obviously will be a little bit different. Some states, Pennsylvania, Virginia, Colorado, California, some others have their own exchange, but it looks, feels, walks, talks just like the federal version of it for all other states. So if you live in one of those states, don't get hung up too much about it. It's just a different entity that processes it, but it's the same thing. So I've got 117 plans to choose from. That's way too much to consider and really like make a clear decision without going nuts. So I'm going to scroll through and just kind of show you what to look at here. It's sorted by lowest premium to highest, just because that's how everything price-wise on the internet is organized. And I've got this monthly premium here. This is my net cost after that subsidy, that savings is accounted for. And the red here is the true retail price, if you will. Then I've got my deductible, and then I've got out-of-pocket maximum. And then if there are copays on a plan, it's going to be listed here. So doctor visits, that's for a primary care, physician visit, a specialist copay, so like a dermatologist, something like that. And then generic drugs, if there's a copay for generic drugs, it'll show there. These are the highlights. These are arguably the most important details of specifications of a plan that you want to look at when you're comparing them. So that's why they're here front and center. And so every tile here is going to have that for the specific plan. I'm just going to show you kind of what a page looks like. Okay, so I'm not going to scroll through this, and even though I'm familiar with this market and I know it like the back of my hand, I'm not going to look at this, or at least narrow it down this way anyway. So what I want to do is, as a next layer of filtering, or I guess the first one, is plug in doctors, hospitals, facilities that are like must-haves. So why I say must-haves is more often than not, there's going to be some, if you've got like 5 different doctors you see for various things, there's going to be one of them that, isn't in network with a certain plan, but the rest are, and otherwise that plan looks awesome. Just keep an open mind and just be realistic. Like in some cases, you're going to have to ditch your current doctor for something so that you can get a plan that has a more important doctor in its network. So we're going to do it based on network. I'm going to add in my doctor and a preferred hospital just to show you what that looks like. So this is my primary care physician. I'm going to add him. And then hospital, I'm going to choose one that's close by just in case. And then one that I know is reputable. So Northside Hospital in Atlanta. I know that well. We delivered our child there. So I'm going to add that. And just to keep this simple, that's all I'm going to add. You can also add prescription drugs if you want to see like estimated pricing or whether it's covered. I don't find that to be quite as accurate, so it's just not really worth the trouble. Prescription coverage on these plans, if you've chosen a plan based on doctors, hospitals, everything else, the prescription drug benefit's going to be, it's going to be good enough for you. Let's just put it that way. If you try to slice and dice and optimize it for everything, you're going to end up with nothing. So with that said, I can now filter by these 2 providers in this case. So I'm going to check these boxes, and then it's going to filter this list. Let's see what we're at. We're at 40 plans now. So we're down from 117. Great, we got something to work with. So let's just scroll down and see what we're looking with. Just scan it real quick. So I've got Oscar Health. One other thing to notice is the metal levels. So bronze, silver, gold. That's pretty self-explanatory. It's like good, better, best. Just an easier way to categorize plans. So here's a lot of Oscar plans. Here's Care Source. Here's Anthem Blue Cross Blue Shield. That might be more familiar to you than these others. Let's go to the next page. More Oscar, more Blue Cross. Okay, so now, even though we have narrowed the field down, you're probably still like, this is crazy. How in the heck am I supposed to choose between all these? And even from the same company, that might even make it a little bit more daunting. So I agree, but here's what I like to do now. Let me go back to the first page. So we've done our first level of filtering, which is want to make sure as many providers as possible are in the plan's network, because a plan's really no good if you can't go to an in-network provider. It's just, it doesn't make sense. So we've got that taken care of. Now we do more of like a manual or subjective filter. And what Health Sherpa is really good at, and healthcare.gov does this too, you can compare some plans up to 5 at a time. And so we're going to go through this list, and we're going to pick a few that I might suggest you choose from. And that way we're going to narrow the field down to a maximum of 5. And from there, we're going to look at the plans in detail. So for the sake of just covering every base, let's pick a bronze, a silver, and a gold plan. What you might find is after you've put in your providers, you might find that one insurance company tends to really kind of pop out at you. Like in this case, Oscar is really popping out as far as the doctor and hospital are in the network. As far as pricing goes, they clearly have the most affordable plans. And so I could either choose among all of Oscar's plans and just keep it to that and just not consider any other insurance companies. That's fine. Or I can keep it open to, well, let me take one from Oscar, one from CareSource, one from Anthem Blue Cross, and do it that way. Neither is right or wrong. I prefer to, once I know the network, I know my providers are in network or not, and I get an idea of who's got the most competitive pricing, I prefer to just narrow it down to one insurance company, because it just flows more logically. So from that perspective, let's do that for Oscar. And I don't have any bias. I don't really care. I'm just, for this example, it's what makes the most sense. So let's pick a bronze from Oscar to get started. This bronze classic standard is a good one. Let me show you why. Compared with this first one, this bronze simple 2, couple things. Yes, it's more expensive, but the deductible is lower by a good margin. The out-of-pocket maximum, it's a touch higher. I'm not even going to call sides on that one. Let's call it the same. The big stuff, or the big difference, is copays. So primary care visit, $50. Specialist visit, $100. Generic drugs, $25. The visits is what I'm really looking at for copays. This plan up here, where it says no charge after deductible, that is just a nice way of saying you're on the hook for the whole cost until you meet your deductible. And a primary care visit, I went the other week and it was $290 something. Okay, so I'll take a $50 charge over a $290 whatever charge any day of the week. And if you have, you may be healthy, but you go to the doctor for an annual physical or something, but what if you got to go to, hey, doctor says, let's do follow-ups. Let's do a follow-up every month, every 2 months. Well, then there you go. If you don't have a plan with copays, you're $300, $300. And it makes you feel like your health insurance plan isn't doing anything for you. So paying a little bit more for a plan with copays. Now, this is not a direct comparison. These plans, the only difference is, it's not that the only difference is one has copays and one doesn't, but apples to apples, a plan with copays is going to be a little bit more expensive, but in my opinion and in my experience, it's worth it. And you feel the health insurance working for you much more. Count that as you would. But as a consumer, I like that. Okay, so all that's to say, I'm just choosing plans with copays. If there are no copays or like a split, which we'll probably see, then I'm not going to consider it. So here's my bronze. Here's kind of my good option. Okay, let's scroll down, and you can filter by metal level. So let's go ahead and do that and make this quicker. So I've got my bronze, and I've got my running comparison chart down here that has appeared once I check that first one. I'm going to click silver. Okay, and then let's go back to the top. See that new filtered list. Here is another silver, another Oscar plan, I should say. Okay, that looks okay. And then let's get a gold in here. All right, let's get an Oscar gold just to kind of keep it simple. All right, so I've got 3. I could add 2 more if I want, but really, if you can get it down to a good, better, best, that's good. So let's compare. And now I've got this nice, simple list, no distractions, and I can compare these side by side. So I'm not going to walk through every detail here, but all the big stuff is here: deductible, max out of pocket. This estimated all in is simply, let me go back to show you that. This usage estimate, this low, medium, high, the default is medium. If you're going to a doctor once, twice a year, go low. If you're going 5 times a year, go medium, go high if you're higher than that. And what that does is that will calculate this estimated all in through each of these plans. How much is that going to cost you, factoring in what the insurance is going to help pay for? The lower the better, obviously. This overall rating, I wouldn't pay attention to it. Quite frankly, I don't know exactly all the details that go into it. The idea was to adhere to kind of the review culture we have nowadays, but it's not calculated in a way that's relevant at all. So Oscar, for example, they're a newer insurance company, but they've been around long enough to where like they've got staying power. They're here, they pay claims, it's all good. Copay is all down here, like we've already covered. Co-insurance, so once you meet your deductible, how much are you paying? How much is the plan paying? This will indicate how much you would pay. That's how they've described it. And then urgent care copay, there's another one that we didn't see in the kind of summary view. Okay, and now at the bottom you've got some links. So if you want to go even deeper into these, you can go a couple places. There's plan details, which is within the platform, and it just kind of breaks it out a little bit more. If we go back, let's go back to the comparison. The second link is going to be a summary of benefits. So every plan, so even group health insurance plans, every plan has this document called a summary of benefits and coverage, or SBC. And they all look just like this: the formatting, the colors, the order of all the details and questions and answers, everything. Which is it's nice to be able to kind of quickly or relatively quickly compare. So like, it answers this question: do you need a referral to see a specialist? The answer is no. If you have a test, if you go to a network provider, here's what it's going to pay, or here's what you pay. So take a look at that as well. So your kind of one-off what-if questions are going to be answered for the most part in that. And then prescription directory, that's the formulary, which is just the list of covered drugs. And then depending on the insurance company, that link's going to take you to either a PDF or like a directory on the insurance company's website, whatever, so you can look up your drugs and make sure they are covered. And those are the 3 links I pay attention to. Brochure, so what? That might be a little bit of help if you want. But anyway, that is how I would compare them. And obviously you can mix and match. You can remove this, add another, compare insurance company to insurance company, however you want to do it. So that's how I shop for plans when I help a client. That's kind of the order in which we move through the considerations. And then at the end of our discussion, we've got something like this. Like, okay, we saw those 117, we're down to 3. And so now from here on out till you make a decision and we enroll in a plan, we've determined that these are the ones to choose from. Don't worry about, well, let's go back and like go to the other ones and run a different, like if you've done what I have done in this video, then you are going to be all but certain that these are the best ones to choose from. It's like the structure of the exercise. So I'll end the video there as far as instructional content or just kind of what to do, the process. There is one other thing that I would do is kind of just a safety measure, and that is related to the network of the plan. So network being, if you go to a doctor, hey, doctor, do you accept Aetna? Do you accept Blue Cross? If they say yes, they're in the network. That's kind of the idea. You want to make doubly sure. You want to be as sure as possible that your doctors that you like, God help you if you can, are in the network. You want to make sure of that. So while this directory built into Health Sherpa is very good, I would confirm it 2 other ways. The first is go on the insurance company's directory for providers that participate in that plan's network. And the second would be go straight to the source, go to the doctor's office. You can check their website, but I would call them, ask to speak to the insurance coordinator, the billing person, whoever handles insurance at the office, and confirm, hey, I'm looking at this Oscar Gold Classic Standard ACA plan. Can you confirm that you're in the network, that you accept that plan? And just get it from them, get confirmation from them. That's the real safe bet. I'll show you what Oscar's directory looks like, just to that first way to confirm, show you what that would be. So I'm going to click plan details here, and it doesn't matter what specific plan with Oscar, you just click that, and then down here, provider list. And every insurance company has some sort of tool like this where you can look it up. And so like I'm gonna look up my primary care physician. Here he is. Okay, and I see up here he's in network. All right, great. So I've confirmed that. And then I would also go to the, let's see, I like to just Google the name, and then not every health system or doctor's office is going to have something like this. This may not even have it, but let's see. So Wellstar is the health system that my doctor is with. I'm not seeing anything on this page, but I see, like, if you see something for patients or about us or patient information, that's kind of what you're looking for on the website. And then accepted insurance. And then they've got a link to a document. And that would just be to download it, but you get the point. You're gonna have to dig a little bit if you want to be super, super sure. And it's just, better safe than sorry. So anyway, that's how I shop for these plans. That's how I would do it for myself. It's how I help my clients do it. This is the process. And I think it's just what makes the most sense. It's the most, consumer friendly. We're not nerding out on insurance. We're just narrowing the field, making the best choice out of what's available to us. So anyway, hope you enjoyed that. Hope that was helpful, and see you in the next one.